Okay. Bismillah ar-Rahman ar-Rahim. I'm going to give a short talk today about the oral health impacts of nutritional deficiencies. So my talk is actually overlaps with our previous speakers, his talk, his valuable talk actually overlaps with his talk, which is interesting. So a lot of the things he said in his talk, in my talk, I will reinforce, and the viewers can see it overlaps. So thank you for your previous talk, Johnson. It was very good. So the oral health impacts of nutritional deficiencies. I can go to the next slide. So what are nutritional deficiencies? So nutritional deficiencies are basically our body requires many different vitamins and minerals, as I'm sure you know, that are very crucial for both the body's development and so the body's development from a young age, from when we're developing in our mother's womb to the point we are born, and growth and development as we grow, and they are also very important. These vitamins and minerals are very important for preventing diseases, like our previous speaker discussed well. These vitamins and minerals are often referred to as micronutrients, and so they have different terminology there. Vitamins, minerals, micronutrients. These micronutrients are needed by our body in very small amounts. They are not produced naturally in the body, so we need to get them from our diet. Nutritional deficiencies occur when the body doesn't absorb or get from the food, our diet, the necessary amounts of these micronutrients. So they're needed in small amounts, and we need to obtain them from our diet, from our food sources. Micronutrients impact on the body's health are very important, are critical, and any deficiency in any of them can cause severe and even life-threatening conditions. They perform a range of functions, including enabling the body to produce enzymes, hormones, other substances needed for the normal growth and development. So we all need enzymes, for example, in digestion. We need hormones for our metabolism, and as you know, these are critically important. So these micronutrients are required for the body to produce these enzymes, hormones, and other substances needed for its normal growth and development. And so any deficiencies can lead to a variety of health problems. So my talk mainly is, because I'm a dentist, and my talk today is to relate these deficiencies, nutritional deficiencies related to oral health. So inshallah, that's what I will do today. The problems these can cause can be related to digestion problems, skin disorders, stunted or defective bone growth, and even dementia. So of course, these are for our doctors to expand on, and we have in our group knowledgeable doctors. So sources of nutrients, the amount of each nutrient we should consume depends on our age. So for example, a child or a baby or somebody in their teenage years needs more different nutrients to somebody, for example, who's middle-aged or more elderly. So it varies depending on our age. In the United Kingdom, many foods that we buy in the supermarket or elsewhere, for example, in a grocery shop, such as cereals, bread, and milk, these are already fortified. They include these nutrients that are needed to prevent these deficiencies so they include them. Sometimes the body, unfortunately, is unable to absorb these nutrients, even if we are intaking them. So it is possible to be deficient in any of the nutrients the body needs. Okay, so sometimes there's a problem with the absorption of these nutrients. So it's not just if the body is not receiving them, but it's not. Sometimes we are consuming them, but the individual cannot absorb them. So again, these can be expanded by the medical practitioners in our group. The causes of lack of absorption of micronutrients. It's not for me to say in this talk. So as a dental professional, we are in a very fortunate position we are in a very fortunate, jumped a slide here, sorry. We are in a very fortunate position to notice changes in our patients over time. So often we see our patients from like a young age, and we see them over many years or decades. So we are in a good position to be able to sort of notice changes in our patients, as well as benefiting the health of our dental health and oral health of our patients. Dentists can also have a positive effect on their patients' well-being, their overall health and their well-being. So in this talk, I'm going to discuss with you sort of the physical manifestations that can be seen in patients due to nutritional deficiencies. So specifically oral manifestations of nutritional deficiencies that we can see in our patients. Inshallah. So one of the micronutrients we all need is vitamin C. It's also known as ascorbic acid. So vitamin C plays a very huge role in the synthesis of collagen and integrity of blood vessels. So all our most of our tissues like skin and gum tissue have collagen, and also blood vessels, which are everywhere in every part of the body, to provide nutrients to the cells of the body. The vitamin C plays an important role in the synthesis of collagen and in our integrity of the blood vessels, which help to provide the nutrients that every cell in our bodies need. So insufficiency can result in like blood blisters. So in the mouth, we can notice like small blood blisters for example, in the floor of the mouth, below the tongue, for example, because the blood vessels haven't formed as well as they needed to be formed. So that we can see like a blood blister forming there. And in the past, for example, when soldiers were, they had to go to battle and war, and they were like away from their homeland, and they were not able to receive enough vitamin C in their diet. They developed a condition called scurvy, which is due to a lack of vitamin C. So scurvy is a condition that leads to bleeding gums because of the blood vessels not forming well, and can lead to loss of teeth as well. In a more severe form of scurvy. So this is a picture of a patient, of a person with scurvy. Like you can see that their gums are very red, inflamed, very swollen. It's bleeding. So this is because they're lacking in vitamin C, and their blood vessels in their gums have not formed, have developed into these sort of red areas, and it's called scurvy. Okay, so it's a disease due to a lack of vitamin C, ascorbic acid, and the symptoms are like, other than oral manifestations of the disease, the person can feel very weak, very tired, and they can feel like their arms and legs are very sore, and without treatment, their red blood vessels will decrease, and they will develop gum disease, and they can get changes in their hair, and they can get bleeding from their skin as well, again due to the blood vessels not forming as they should due to lack of vitamin C. So vitamin C is a very important nutrient we all need. This is a picture of a person with a blood blister on their, I think it's below their tongue, just on the side of their tongue, and you can see it's a blood blister there formed. Blood blisters may be more noticeable in a patient who is a smoker, because what happens with smoking is it uses up the antioxidant effect of the vitamin C, so that there's even more need for vitamin C by the body. So in a smoker, you can see these conditions, these sort of blisters more commonly than in a non-smoker, because they need more vitamin C, because smoking uses up the antioxidant effects, properties of vitamin C. And reactive oxidative species from white blood cells lead to destruction of periodontal tissues when in the presence of bacteria, which is plaque, and as they are non-specific, they will harm healthy tissues too. So if there's lack of vitamin C, there will be destruction of there'll be these ROSs, which will cause destruction of the white blood cells, and this can lead to worsening of periodontal disease, which is gum disease. Because in gum disease, the body's defense mechanism, which are the white blood cells, they're not functioning as well as they should. So the bacteria become more virulent, and they cause more harm, which is loss of periodontal tissue, damage to the periodontal tissues, which leads to the teeth becoming over time more loose, and they become mobile, and the gum disease and recession, and can lead to eventually the tooth being lost. So vitamin C has an important role to play in preventing gum disease. But thankfully, most people have, their diets are, in today's in the 21st century, most people will have enough vitamin C in their diet. But in some countries, it may not be the case, sadly. So vitamin C and periodontal health. So vitamin C plays a role in the collagen production and antioxidant property. It has antioxidant properties. It's a very important nutrient for periodontal health. According to the National Health Service website, an adult needs 40 milligrams of vitamin C a day, which can be easily achieved by eating a varied diet of fruit and vegetables. So the advice we give to our patients as dentists is to avoid. Our patients should eat about 10 or 11 portions a day of fruits and veg, while making them aware that vitamin C is water soluble. So as vitamin C is water soluble, it's therefore not stored in the body. So it needs to be replenished on a daily basis. So every day we need to have 10 or 11 portions of fruits and vegetables. And vitamin C is found in most fruits and vegetables, and that's the main way it's absorbed by the body through from these sources. And according to the National Institutes for Health, a smoker needs an additional 35 milligrams per day. So so they need to benefit. They need more vitamin C. They need supplementation if they are not willing to, or prepared to quit. We all know the effects of smoking as well for lung disease and other problems it causes, skin problems. So this slide here shows you a picture of some of the best food sources for vitamin C. So for example, all the greens and all the fruits. So oranges are very good, lime, grapefruit, pineapples, and as you can see, and all the greens as well, like green peppers and Brussels sprouts, broccoli, and these are all good sources of vitamin C. So the next micronutrient or vitamin that the body needs is vitamin D, and vitamin D is required. If we don't have vitamin D, so basically vitamin D deficiency enhances the mobilization of calcium from the bone. So people who are not taking enough vitamin D in their diet, the calcium in their bone will need to become mobilized, and this can result in osteoporosis. And vitamin D deficiency can also be a potential risk for periodontal disease, because periodontal disease is is a disease of the jaw, of the support of the teeth, the bone and the periodontal ligament supports the teeth. So if the calcium in the bone, the jawbone, is affected, then that's going to have an effect on the teeth, so the tooth support, and periodontal disease can result. In 2018, Jelvehgaran et al. Concluded that vitamin D is significant in periodontology due to the specific immune response by suppressing the destructive effect of chronic periodontitis alongside the role in jawbone density homeostasis, preventing osteoporosis. So vitamin D, as I'm sure you know, is important for healthy bones and preventing osteoporosis. And lack of vitamin D increases the risk of osteoporosis and can lead to fractures of the bones of the body, long bones, if it's very severe. Clinical studies have suggested that a deficiency of vitamin D leads to periodontal inflammation and a delay in healing. So as dentists, for example, we do a lot of treatments for our patients because it's very common gum disease. Most people have at least early gum disease, there are 3 levels of gum disease: early, moderate, and severe. So most people will have some form of early mild gum disease. So vitamin D leads to periodontal inflammation, lack of it, and it can result in delay in healing of the gums, and I'm sure other parts of the body. So if as a dentist we suspect our patient is not having enough vitamin D in their diet, then it's worth routinely speaking with the general medical practitioner to have the patient seen by them, to have their vitamin D status checked. Okay, so that's how we can help our patients in that way. If vitamin D deficiency is suspected, then a test is needed to provide a baseline before supplementation is recommended. So if we see a patient who has like severe form of gum disease, then we should suspect that maybe we should ask them, do you feel you may have a vitamin D deficiency? Have you had your vitamin D levels tested? Would you like to be referred to your GP to have a blood test to have this checked? This is good practice. So those were the first 2 micronutrients, vitamin C and vitamin D. The next one I would like to discuss with you is magnesium. Insufficiency, lack of magnesium can manifest as a tremor, a tic, or twitching. Okay, so which can cause sometimes, for example, the tongue of our patient when we are treating them can be like quivering at rest. So if we see a patient who has their tongue is a bit maybe quivering, we could suspect that maybe they have magnesium deficiency. This can be quite noticeable during dental treatment as it can move. Sometimes the tongue can move instruments, or it can fight, for example, the suction that we are using to keep the patient comfortable. So if their tongue is very frantic, very, quivering and moving much, we can suspect magnesium deficiency as a possible cause, but it's unlikely to be, but there's a possibility as well. Magnesium plays a vital role in the production of cellular energy. So if there's quivering of the tongue, it wouldn't cause any harm to recommend magnesium bath flakes, as magnesium is actually absorbed well through the skin. So magnesium is absorbed transdermally, which means it can be absorbed through or by way of the skin. So there's no harm in recommending having a magnesium bath flake, just giving that option to our patient as something they can try. If, for example, their tongue is quivering much. Magnesium, so sorry, I just moved this out of the way. So Goyal et al. In 2013 highlighted the link between stress with system inflammation, including periodontal disease. This is due to the physical factors and also psychosocial behaviors linked with feeling highly stressed, for example. So sometimes when we see a patient who has very poor oral hygiene, sometimes it's because they've been they may have had a very stressful time in their life recently. For example, they may have had a bereavement, or they may have had an exam, or they've had a difficult event taking place in their life. So they may be very stressed, and this magnesium can also be one of the factors that they have a lack of magnesium, which is causing them tiredness and fatigue and poor oral hygiene. So during stress, the body actually needs more magnesium. Food sources are numerous and includes, for magnesium, the food sources are numerous and include like spinach, broccoli, kale, avocado, legumes such as kidney beans, chickpeas, bananas, raspberries, salmon, mackerel, and tuna. So all of these food sources will provide magnesium for us. So as you can see this picture here, these are foods with high levels of magnesium. So spinach is very good. Chia seeds or mackerel, of these have very good sources of magnesium. So the next micronutrient that we need is the B vitamins. These are sometimes known as the stress vitamin, as same as magnesium. These B vitamins, we use them up a lot more when we are stressed. So when we feel more stressed, we should maybe think about having some supplementation of B vitamins, magnesium, because these are needed more by the body. Young and colleagues, 2019, provided a systematic review that found that increase in B vitamins either through the diet or supplementation actually improves the mood, can help our mood and help to decrease anxiety in these participants. So it's a good way. It's a good option. It's something that we can consider if we want to boost our mood, have more B vitamins and magnesium. And of course, magnesium is required more when we are more stressed. If we don't provide this additional need, then the following conditions can occur. So I just don't want to take up too much of your time. So you can see here, deficiency in B vitamins. So here, there's a picture of a person with soreness in the corners of their mouth, which are not healing after a few weeks. So these are bilateral sores and the cracked tongue as well. So deficiency in B vitamins can result in soreness in the corners of the mouth, and which don't heal as they should. It can result in a condition called angular cheilitis also. So it's kind of it's another condition which it can develop into. And here's a picture of a tongue of a person with deficiency in B vitamins. So cracks in the tongue, as you can see, it doesn't look normal, this tongue. It's not a healthy tongue, and it's red at the tip. It's also, we describe this tongue as a geographic tongue because it's like you can see pictures of lines and creases, and we use the word geographic tongue. And this can be a sign of vitamin D deficiency. So if we notice this, we need to inform our patient. Red tongue is also known as glossitis, is a red beefy tongue. This is another condition that can result due to lack of B vitamins. It's a useful way to diagnose it. So we should pay special attention to the oral manifestations during physical examination. So in high-risk people such as the elderly, vegetarians, and patients with digestive problems. So patients who have these conditions, we need to sort of, when they come to visit their dentist, the dentist can and should check for these signs in their mouth, like on their tongue, their lips, to see that maybe they have a deficiency. If we do notice any sort of signs or symptoms, we can refer our patient to their general medical practitioner, their GP, and this can be potentially preventing a serious health issue in that patient. So we can help them in a very major way prevent serious health issue. Inshallah. And the B vitamins are synthesized and absorbed through the small intestine. So patients with digestion absorption issues, supplementation may not help them as they may struggle to absorb. So if some of our patients, if we know from their medical history that they have digestive problems, vitamin B they may not be able to absorb the vitamin B from their food sources or supplementation. So if a patient has digestive issues, they need to see their GP or a nutritionist or a dietitian to help them with this. Supplementation may be needed in the form of an injection, which will bypass the normal system of absorption through the digestive system. So they may need to have an injection of vitamin B if they can't digest it themselves. So action to take here would be to refer to their GP if we notice this. Here you can see vitamin B's, foods that contain vitamin B. So carrots, so as our previous speaker very well explained, the importance of the diet and prevention, and genetics only plays a role in health problems. It's not the main, usually it's not the main cause of health problems, but it's the environment. So the food we have and the exercise and our health, stress, how we manage stress and how we live our lives, which are really key to how well we live our life and the quality of our life and preventing diseases and problems. So here you can see B vitamins and foods that contain it. So I'm sure you're familiar with all of these foods. I'm sure you're all familiar with these foods. So the vitamin B is found in most food sources, which include like meats, seafood, dairy products like cheese, milk, and leafy vegetables, and beans and legumes. So there we go. The next important source of micronutrients and vitamins and minerals, well, these are micronutrients, are fatty acids and omega-3. The National Institute of Health describes the most common sign of deficiency of fatty acids and omega-3 as sort of a rough, scaly skin and dermatitis. So dermatitis, or these symptoms, signs and symptoms can be due to lack of essential fatty acids and omega-3. These can be noticed as a dry, flaky lips or flaky skin under the eyes. So under the eyes here, or the lips can be flaky. One of the reasons omega-3 is so important is because of the anti-inflammatory effect it has on the body. However, in today's diet, in our modern diets, a lot of people eat more omega-6 foods, which are usually processed foods rich in vegetable oils. So they don't contain omega-3, they contain omega-6. And this is a problem because omega-6 has a pro-inflammatory effect as opposed to an anti-inflammatory effect, which omega-3 has. So there has to be a balance between omega-3 and omega-6 for the body's health and development. So these are the top 10 foods which contain omega-3 and fatty acids, like chia seeds, fish, of course, as you know, salmon, shellfish, which I don't think that's allowed in Islam. And you can check that yourselves, please. So like avocados, like Brussels sprouts, these are very good sources of seeds, like flax seeds, chia seeds, fish, walnuts, tofus, and are good sources. It was discussed in 2014 by Hibel that the importance of omega-3-6 ratio, and if more omega-6 is consumed than omega-3, this leads to a tilt towards inflammatory processes in the body, and this becomes a problem. So then, as dentists, we can recommend to our patients to eat oily fish 2 or 3 times a week, while reducing foods containing hydrogenated oils, processed oils, vegetable oils, to help them to achieve this balance. So these vegetable oils are detrimental in increased amounts. The next new micronutrient I'd like to speak to you about today is zinc. So zinc, according to Pisano and Hillas, zinc deficiency may lead to loss of appetite, impaired immune function, weight loss, delayed healing of wounds, eye and skin lesions, and smell and taste disturbances. So, for example, if our patients come into us and say, oh, I can't taste my food as well, or I can't smell my food as well, it could be a sign that they may have a zinc deficiency, or they have less appetite, or they have like eye or skin lesions. So as a dentist, we can spot these signs and we can investigate further and ask our patient, for example, about their diet, ask them to carry out a diet analysis or do a diet history for us, like what they eat in the past sort of 3 days or so, and we can sort of start investigating further. Even though there may not be a physical manifestation present, a patient will often talk about a bad taste or even lack of taste with their dentist or doctor. Like a bad taste. But bad taste can be there are other causes of a bad taste or lack of taste. For example, some mouthwashes, if used excessively, can result in a lack of taste. There are other oral diseases or that can manifest as a bad taste, but again, they require further investigation or referral to a specialist oral medicine doctor, or to we should refer, for example, if we are not sure what the cause is, we should refer to the GP or to oral medicine specialist. Osler advised that the findings suggest a relationship with zinc deficiency and recurrent aphthous stomatitis. So a lot of the time we see in our patients, they come with like ulcers in their mouth. That's what aphthous stomatitis is. So, and this is frequent. Suggested frequent oral ulceration could be connected to zinc deficiency. So aphthous stomatitis is like recurrent mouth ulcers, and this could be connected to zinc deficiency. But aphthous stomatitis or ulceration, nobody actually knows what the cause of this is unclear, but it may be due to zinc deficiency. So recurrent aphthous stomatitis is a common condition. It's very common, in which round or like ovoid painful ulcers recur on the oral mucosa. So I'm sure you've all had occasions where you had an ulcer in your mouth. Maybe you've like burnt your mouth, or you've bit your tongue or your cheek, or you've been tired or a bit more stressed and you've developed like an ulcer. So this can show, as you can see here in this picture, these pictures. So the etiology is unclear of oral ulceration, but the diagnosis obviously is clinical, so we can see this in the patient. And the treatment is symptomatic and usually includes like just topical corticosteroids. So we can't prevent ulcers forming, coming and going. They just come and go when they, sometimes we don't know why we get mouth ulcers always. The etiology can be unclear. So usually the treatment is like symptomatic treatment. So this is just to relieve the symptoms with topical steroids, like corticosteroids, like a steroid mouthwash or a steroid cream, oral gel and cream that can help to relieve the symptoms. So just to today's take-home messages for all our respective viewers is to basically a food first perspective is recommended. So we should look at the foods that we're having, what our diet is actually really like, and as dentists we can advise a good wide and varied diet to avoid the deficiencies mentioned in this talk. So if we have a wide and varied diet, healthy diet, balanced diet, then we can avoid all of these deficiencies, nutritional deficiencies. So we advise, as dentists, we advise our patients to have like oily fish 2 or 3 times a week, while we advise them to avoid like hydrogenated vegetable fats to achieve the right omega-3/6 ratio. We should advise our patients to have at least 10 to 11 portions of fruits and vegetables per day. And I'm sure you all try your best to have as much fruits and vegetables as you can each day. And of course, 6 to 8 glasses of water per day is always recommended, as water is very important, as most of our bodies are formed of water. So this is very important that we are well hydrated and we drink enough water every day. And as dentists, we should not supplement. We shouldn't just like say to our patient, just take like just take supplements, vitamin and mineral supplements. We shouldn't just blindly say to them, as there may be like an underlying issue, like for example, the patient's absorption, maybe a problem like the digestive system. Just green pharmacy can provide side effects as well, because having too much supplements can cause side effects, and everyone has their own individual needs. So we shouldn't just say to everyone, just have supplements. It has to be case by case, and we have to make the right diagnosis first. And also there can be drug interactions as well. So we don't want to cause drug interactions. Dentists can refer to the appropriate person if the patient can benefit from this and they are open to it. So of course, if the patient doesn't want to speak to their GP or dietitian or anyone else about their diet, then that's their choice. But if they do, we can recommend, and refer them to the appropriate person. This can be the patient's GP, a local nutritionist, a dietitian, or any other healthcare professional that is relevant to the patient. So we can, as dentists, because we're limited to what we can do in terms of managing this nutritional deficiencies, we can spot the signs and we can refer to the GP or medicine specialist who are experts in